IV infusions and ulcerative colitis. So let's talk about some ways that you can make those days more comfortable and feel better about it. So I am not on any IV infusions, but I have had many patients that are on IV infusions or biologics to treat their ulcerative colitis or Crohn's. And it can bring up a lot of fears for sure. I think it's normal to feel fear about that because it's brand new. A lot of times people are starting them, when they've just got this new diagnosis and now they're embarking on this treatment they're not certain about. And it can bring up a lot of stuff for people. And, it can be hard to kind of come to terms with the fact that it is like a longer term decision. And there's just a whole lot with that conversation to unpack for people.
Yes, there is actually always. And I guess around that too, with myself having Crohn's, there has been times where I have had to have infusions. And for me, I was always nervous about the reaction piece. Was I going to?
Yeah.
But the really great thing about that is that, reactions, the more extreme ones or the side effects that you may get from these medications is quite low. And any kind of allergic reaction, the really great thing is that nurses at the infusion centers are trained to react quickly and know what to do if that is to ever happen. So I think for myself, what I found really helpful was having that discussion with the nurse when I was there, just to calm any kind of like fears or anxiety I had around it, and being like, okay, what are you going to do if I have an allergic reaction, right? And like having them tell me that just made me feel better. Now,
Yeah.
I know not everybody feels that same way, but having a discussion with your healthcare team is always so helpful to lessen the impact it can have on you in that way, I feel.
Yeah. And I also think too, we talked about this on a previous YouTube before, but if you're feeling nervous about it and nervous about the risk associated with it, is always important to also consider the risk of not treating something. That's something that's not talked about enough. There is risk with letting inflammation just keep going and not doing anything, and risk to, not having any sort of support. So if you are to weigh the pros and the cons around taking it versus not taking it, it is important to consider that. And I can't stress that enough, just like in my own journey, having had so much fear on medications that would delay a lot of care for myself and put me in very dangerous situations at different points. So even if you feel like things are okay, it is important to still treat it. Rely on your labs, rely on, what's going on underneath the surface, because even if you feel fine and you're not symptomatic, you can still have ongoing inflammation. So it is important to be able to check that and to also have a plan in place to treat it.
Mm-hmm. Absolutely. There's always someone too that you can talk to around that.
Yeah. And I think too, like, it's important to be able to have that conversation with your GI of being able to feel comfortable enough to disclose when you're not comfortable, so that maybe instead of ghosting them for like months or never coming back, you could have that conversation with them and let them know, hey, I'm feeling really nervous about this medication route. What other options are there? And just having that conversation and trying to be with a team that will allow you to have those fears, I think is a great first step, because then you can explore what all options there are. Because a good provider is going to be patient with your fears, is going to walk you through, these are the pros, these are the cons, these are alternative options, this is the risk of not doing it. I think a good provider will walk you through all that and will understand what it's, will understand to an extent, what you're going through with those fears, and can kind of help guide you a little bit more.
Yeah, 100%.
Let's talk about some like things that can help you feel comfortable. Like you listed one, like, being frank about your fears. to your providers and to your infusion nurse. And also, another thing that I've seen a lot of our patients do is there's different ways to have infusions. So you could go out to a place where you have your infusion. Some people will do in-home infusions. There's a lot of medications now that can be shipped to you versus, if you don't want to go to infusion site. So you want to work with yourself on like, what do I feel most comfortable doing, and what's the environment that will be the lesser stress of them all. Some people like to go out and do it, so it's like out of the home and they can make an outing about it. Maybe they can go have a nice dinner after or whatever it is.
Yeah.
And other people really like the comfort of like being in their own home and being in their pajamas or just being able to fall asleep easier after. So I think finding the right location and finding the way that you're going to feel most comfortable is another thing you can do to really support yourself.
Yeah, absolutely. Because there are lots of options out there when it comes to it. With Skyrizi, for example, you start off with infusions on your loading dose, and then you have the option to inject yourself, or a nurse can do it for you. So if you're not comfortable injecting yourself, you still have that option for someone else to do it. So, or maybe you feel more comfortable doing it yourself at home, and then you have that comfort there. So it is nice to have options with a lot of these medications. And I think the important thing too, Ashley, I feel like I learned this more from my husband. My husband has been so chill about medications, and there's a lot of other people out there like that. And that's
Great.
great. So I guess why am I saying this is because I guess I can appreciate his trust and understanding in the system, really looking into things and being like, yeah, they're going to take care of me. They're going to check in on me when they need to. I'm going to advocate when I need to, that sort of thing as well. But that there's confidence in this as well.
That's good to know. I definitely probably would fall into the opposite. That's an area that I want to grow in. So you probably hear me say a lot of stuff that makes you think like, oh, she must have had some fears. But yeah, it is really encouraging to see that. I feel like, especially nowadays, because I feel like there's a lot of mistrust, honestly, in healthcare in general, especially here in the US. I mean, notably so. For good reason there is, but it is also good to kind of be able to trust the treatment plan that you're on, because your mindset does play a role in how things impact you and the extent that they can impact you. I think it's a really important component of healthcare in general.
Yeah, absolutely. So that's an important thing to be mindful of too, is that there's a lot of confidence with those as well. There's lots of training programs that not only the nurses go through, but if you're self-injecting, they train you and you get a little care package every time explaining what to do. So there's a lot there to instill more confidence in yourself if you are doing it yourself too.
Yeah.
Yeah.
Yeah. And I love the idea too of pairing something really positive and uplifting alongside, if it is something that's hard for you, alongside with that. So like, I've definitely done this, not with an infusion, but with other things in my life that are hard. Like maybe going to the doctor. Sometimes that's really hard for me. Like if you're somebody with medical trauma or getting labs or doing a fecal cal test, whatever it might be, pairing that with something really positive. Like maybe you do something nice for yourself that day, or you meet with a friend after, get your nails done. Yeah.
I don't ever do my nails. It's
Either.
that I said that, but yeah.
Yeah, it's finding the little things. Like if you have the budget to do like a massage, or I don't, taking a nap is a luxury, honestly. Like that's a free thing you can do. Now it might not be accessible to everyone if you have to go right back to work, but finding those little things and little ways that you can treat yourself, I think can turn that difficult experience into something you actually look forward to. Any way that you can do that is going to be helpful.
Yeah. Yeah. I feel like at a lot of infusion centers, it's like, okay, let's turn the Netflix on and watch my favorite show. Or,
Mm-hmm.
like you said, even taking a nap in the chair. Some people are able to do that. Some people work as they're getting their infusion too, just depending on your comfort level and how the medications affect you. But I like the idea too of pairing it with something like self-care.
Yeah.
Yeah.
Yeah. I mean, dentist office do that too, like with the TVs on the ceiling and stuff.
Yes.
And it's a good way to disconnect from the moment a little bit, because sometimes that can be a really healthy thing to do. Is, I mean, I don't know about you, but like definitely dental procedure, any kind of dental stuff, it's just like, yeah, I want a disconnect button for sure. Yeah.
And it's possible.
Yes. So I hope this was helpful for you. I thought it'd be good to do just kind of chat a little bit about what we see our patients doing, and in terms of coping with infusions, and just want to share a little about how I work through, stuff that's difficult and what I do to cope. But hope this was helpful for everybody. If you do need some support, feel free to reach out. We'll put some links below on some other resources you can check out and ways you can connect. All right, take care, everybody.